So we talked a lot about, what is compounding or what is sterile compounding in particular. Would you mind discussing a little about what are your experiences in sterile compounding and the types of compounding facilities that's currently present in the field of pharmacy? So,
Absolutely. Thank you so much. So let's just go over some of the types of compounding that um, I am aware of and we have discussed previously to mention in your podcast. It might not be specifically limited to, but these are the main ones that everyone should be informed about. The first one is going to be home infusion, so compounding pharmacies. And that is also one of my experiences in the field of compounding pharmacy. So basically, home infusion is where patients are discharged from the hospital or from the rehab facility, and now they have to be taken care of at home with a provider or a nurse or a caregiver. And we go ahead and we send the remainder of their basically um, the rest of the medication for their treatment regimen that they have to complete. Let's say they have to complete a total of 14 days of antibiotic, and it has to be intravenously injected into their IV bag. So we go ahead and we compound the rest of the medication for them after they're discharged from the hospital. We also do take care of patients who are basically going through a lot of basically different uh, pain management regimens, and they need their pain management medications such as fentanyl, hydromorphone, and such things sent to their home because they are more comfortable in that setting and don't want to remain at the hospital. And that is basically what we do at the home infusion center. We also have a lot of biologics that we have patients come into our infusion centers. Once we compound the medications, it is administered by the nurses in the infusion center. Another type of compounding pharmacy is going to be hospital pharmacies. And many hospitals have an in-house sterile compounding pharmacy, most likely most of them, where they prepare the IV medications, TPNs, epidural injections, and steroid products for their patients who are currently staying at the hospital. Usually, when patients are discharged, they are referred to other pharmacies, like we mentioned, the home infusion centers. I have also worked in hospital pharmacies for over 4 years. It was a very valuable experience, and it really does help you build some compassion for the patients because you have a very, I guess, close relationship with them once you get to see them and take care of them and deliver their medications or compound it for them for several weeks while they are being treated at the hospital. So I think that was a wonderful experience for any pharmacist who's especially interested in clinical practices. Another form of pharmacy, which is one of my favorites, is going to be the 503B outsourcing facilities. And there are two types of 503 pharmacies. One is 503A and one is 503B. I personally only have experience in 503B pharmacy, but I will briefly go over the difference so that basically everyone knows what the differences are. In 503A pharmacies, it's traditional compounding that you create a medication based on individual patient prescriptions. So you only receive one prescription. Patient needs a specific, let's say, hormone therapy cream. You compound it tailored for that prescription and for that patient. But in a 503B outsourcing facility, as the name mentions, outsourcing, you are allowed to compound medications in bulk. You're allowed to create it for more patients rather than one, and you can send it to a basically a doctor's office. But the issue with that is you are not allowed to just create a sort of, let's say, 50 vial of medication and send it to a doctor's office. Every vial that you send has to belong to a certain patient. It has to have a prescription from that physician for a patient. So they're not allowed to just buy these medications and stock up on their shelves. They have to send you a specific prescription, but they can perform that act in bulk And an outsourcing 503B can also ship their medications to different states as long as they have a pharmacy basically license in that state. So that's how that is done. We also have compounding only pharmacies, which they don't offer sterile most likely. They're basically just inside of a more community or independent pharmacy, and they might make pills or capsules for patients, but they don't do more than that. We also have nuclear pharmacies. I personally have never had the pleasure of working at a nuclear pharmacy, but I've always been intrigued by it. These pharmacies prepare basically radioactive sterile compounds, and their process is very detailed, and they have to follow very strict laws in order to prepare these medications, whether it is for vets or whether it is for human patients. And they also do it for diagnostic imaging and therapy as well.
Thank you. Appreciate the detailed description on where compounding pharmacists can practice. Now, speaking about that, I know we talked a lot about these regulations or these things that make it seem really interesting. At least maybe for some of our audience to pursue a career in compounding. So what are some qualifications slash training that someone would need if they would like to work in a sterile compounding environment?
That's a wonderful question. So, personal experience is when I started compounding as a technician back in Texas. I was not living in California back then. The regulations and laws were very different. So I had to take a sterile compounding in a separate technique class. I had to basically complete some of the testing online, and I also had to go there in person and attend a class where they teach you the technique, how to move your hands when you are in the hood. How far within the hood, like 6 inches inside, you have to be compounding and performing these compounding factors and things. But I know that in California, the laws vary. And please correct me if I'm wrong. But here in California, you, as a technician at least, can obtain training to do sterile compounding at the facility that you will be working at or serving at. So in California, you do not need to go through a class in order to obtain those skills and perform compounding. But in other states, you may have to. But in order for you still to be able to compound, let's say as a pharmacy technician, you do have to have your GED or you have to have your high school diploma. The next thing that you have to have is have passed the pharmacy technician certification exam or the PTCE. And that is basically offered by the PTCB, and that is the Technician Certification Board of Pharmacy. The next thing that I have on here is making sure that you're completing your CEs and continued education. Every pharmacist or pharmacy technician and intern, they all have to basically complete these CEs and continuing educations every year, or your license is not going to be active. As well as, such as a pharmacist, every technician or intern has to renew their license. Basically the duration of the time is different. For technicians, it's going to be every 2 years. For pharmacists, I believe it's 4 if I'm not wrong. And for interns, it's also 4 as well. So that's basically we covered what a technician has to have and entail in order to be able to perform compounding. For pharmacists and sterile compounding, they obviously have to be a pharmacist and own a PharmD degree, as well as have passed the NAPLEX and the CPJE in the state of California. And basically, they need specialized training or maybe a compounding certification, just like the one that we previously mentioned. And continued education and CEs are a must as well.
Perfect. Thank you. Again, I really do appreciate, the amount of details being described here. And I also thought I heard I know a pharmacist who actually have a board certified to do sterile compounding too. So I guess that's also another potential thing that someone can acquire to master their techniques and also to also help with their job, daily day-to-day job in terms of regulating the environment. So, lastly, I want to talk about if an intern, right, is interested in sterile compounding, and through their school they got to go on a rotation to go to a sterile compounding environment, or if they get hired by a hospital and part of their intern program has something like this, what are some things that you will advise them to prepare ahead of that rotation slash work?
Absolutely. So I am doing my API rotations with at the FDA right now, and I'm learning so much from them about what they expect from compounding pharmacies. Some really good insight that I got the other day from my preceptor, which, for those who do not know, is our mentor when we go on these pharmacy internships from our school. My preceptor was mentioning the value that the compounding pharmacies bring. And basically, it is in order we ever have a shortage or we need specific medication tailored to patients, that's when compounding pharmacies come in. Their role is extremely crucial, but some issue that arises is if they are not following the regulations, they're not following the SOPs, which is the standard procedures and operating procedures, or they're not following the USPs, like we mentioned, the chapters for non-sterile, sterile, and hazardous compounding. So as an intern or a technician or a new pharmacist who's interested in compounding, I would really dive deep and study and read these chapters. It's not a lot, but it will definitely go a long way. If you know what is expected of you at the position, and you know the things that you have to be following in order to um, basically produce the best product is going to be if you have the knowledge that you need in order to do that. So regardless of which facility you are at and you are being trained at, I would suggest that they read the USPs. It can also go a long way when you're on interviews and you are interested in gaining more access to a compounding position. Being proactive and asking, and practice really does make perfect. But as long as you are doing it during your training where someone is signing off on your work, on your math, and you're not hurting any patients. But I think that the training that I received during the sterile compounding and aseptic technique course really helped me. Even if some states do not require it, I highly suggest everyone who's interested in compounding to go through that course and just get trained with a professional trainer, walking you through the steps and guiding you on how to be the best compounder that you can be.
Thank you again. Really appreciate your sharing of insight today on today's topic, and I again am intrigued by the amount of details that go into these sterile compounding, or even just non-sterile as well. And again, I really do appreciate you speaking us with us today.
It's my pleasure, Ryan. Thank you so much for having me, and thank you for just providing such amazing topics during your interviews and all the content that you're providing to the community. It's a pleasure to be your friend and also to get to be here. So thank you.
Yep, thank you. Again, click subscribe if you love our content. Click like to this video, share this video to our audience or your friends who might be interested in compounding, and we'll see you next time. Thank you.